Neima Nora Candy. I am the National Ebola Coordinator for the Liberian National Red Cross.
Red Cross will shine with you.
First, I was really scared because I didn't know much about Ebola. Not really much. All I heard was how quickly it kills people. So I was really scared. Like any other Liberian, panic and fear.
It's real, yes indeed, Ebola is real, it's killing people every day. It's time to protect yourself, protect your family.
It's time to protect yourself. Ebola is real. Protect your family. Ebola is real. Protect your community.
Ebola was chasing us. We didn't know where it was coming from. We were running away from Ebola. We would just hear that this household, someone is sick in there. But now we basically know a lot about Ebola. We know that the earlier you detect those signs and symptoms and the earlier the person is taken to the treatment units, the better the chances of survival. Because if the person has started showing symptoms and then they are not moved from the household, number one, they will infect the family members, the other family members who are in the household, and number two, their chances of survival will be very, very slim. We know that when the person dies from Ebola virus, at that time the virus is really, really active. It's more active than when the person is sick. So if they are able to take care of that dead person and be able to disinfect the home, they will be able to save the rest of the family members from getting infected. And that is one area that the Liberian Red Cross have been really active and involved in, and it has really helped the outbreak in Liberia. Ebola is new. It's a new type of disease in our country. And most of the things that are being done during this Ebola are quite new to our culture. Like quarantining someone for 21 days and the family members not coming in contact with them, like not shaking hands or hugging your family members. Those are things that really work on you emotionally. Social mobilization and community awareness is one of the strongholds of the Liberian Red Cross because we actually have volunteers in every community in this country, in Liberia. When the Ebola started, our social mobilization messages were when someone gets sick, do not touch. When you have a family member who died with symptoms of Ebola, do not touch. Call the hotline numbers so they will come and pick your sick person up or they will come and pick the dead body up. But we have a lot of problems here in Liberia, especially when it comes to logistics, when it comes to road, when it comes to access to certain communities and certain villages. So sometimes the community members will actually make calls and then the ambulance wouldn't show up, sometimes in 8 hours, sometimes in 24 hours, sometimes 48 hours. And in extreme cases, even 72 hours. We were telling the people don't touch, but we were also not coming on time. So people were actually touching, and then at the end we'll have whole households wiped out from Ebola. Like 10 family members in a house will die, 5 family members, all of them will die from Ebola because they've touched.
So contact tracing, just an example from one sick boy that died in next neighborhood from here, next town. This sick boy came from Monrovia to stay with the father in Bendaja. The boy died. They did a traditional burial of the boy. 2 elderly community members who participated in this both died. Then 2 members of the Bosan community participated in traditional burial of the elderly man from here, both died. Here, daughter of one of the sick gentlemen that participated in the traditional burial of this boy, cares for this man and died. Now from here, multiple children live in the same home with their mother, only from this one now. Their mother, woman who died, 2 died and 2 in ETU when I did this. Probably this already died because we don't have other survivors here. From one boy, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 died from one boy.
Everybody, let us save our country. It's time to protect yourself. Protect your family.
So community-based protection came in. We said, now we need to help the people to give them something that will protect them whilst they are waiting for help in especially hard to reach communities, hard to reach areas.
Protect your family. Protect your community.
So we said we will have this community-based protection with household hygiene kits that are provided within those items that they will use to protect themselves whilst they are waiting for help to come for this loved sick person. So 2 of the family members have been taken to the ETU, and a family of 14 is in quarantine in this house down there. And we are doing a community-based protection because there's likelihood that someone from the house might get sick, and this area is actually a very hard to reach area. So by the time the ambulance reaches here, it will be probably more than 24 hours. So the community-based protection is actually for the family members to be protected whilst they are waiting for help, because we know that in that interim, for when a family member is sick and they've called for the ambulance, if they don't have help, every member of the family is going to touch that sick person, and in that process they are not protected. The rest of the other family members are going to be exposed.
It's time to protect yourself. Protect your family.
I think we've lost over 100 plus health workers in Liberia to Ebola. I've even lost my best friend, who was a registered nurse working with the Armed Forces of Liberia. The first doctors and nurses that died from the John F. Kennedy Medical Center, that was where I actually worked for 5 years of my life at the emergency department, and I worked with all those doctors and nurses for 5 years. So I knew them personally, I had worked with them personally, so it had been like a real trauma for me all throughout this Ebola time. At certain points in time, like probably a month ago, I almost gave up, especially when I lost my friend. I almost gave up, but it gives me a new sense of trying to thrive hard, trying to make an impact, trying to make things work.
Liberian Red Cross, we are all one.
Sometimes I'll get down, I'll get really down, but then sometimes something in me will just push me that it's time for you to push hard. With your help or with your assistant, things will get better, because if you sit and everyone sit, then what's going to become of the country? So, but if you work and other people work, then it means you will make an impact. So that's my only source of hope sometimes.
We are all one.